This video demonstrates a mid-tracheostomy performed under local anesthesia in a patient with oropharyngeal carcinoma and bilateral cervical lymphadenopathy. The patient had advanced oropharyngeal malignancy with bulky cervical nodal disease, resulting in anticipated airway compromise and a need for long-term airway protection. In view of distorted upper airway anatomy, risk of difficult re-intubation, and expected prolonged airway requirement, an elective surgical tracheostomy under local anesthesia was planned following multidisciplinary discussion and informed consent. The patient is positioned supine with a shoulder roll to achieve optimal neck extension. Standard monitoring is ensured, oxygenation is maintained, and the airway is secured. The neck is prepared and draped under strict aseptic precautions, with care taken to avoid pressure over enlarged cervical lymph nodes. Local anesthesia is administered using 2% lignocaine with adrenaline infiltrated along the planned midline incision and deeper tissue planes. Adequate time is allowed for anesthetic effect and hemostasis. A vertical midline skin incision is made from just below the cricoid cartilage to above the suprasternal notch. The subcutaneous tissue and platysma are dissected. The strap muscles are separated in the midline by blunt dissection, exposing the trachea while minimizing bleeding and avoiding nodal structures. The thyroid isthmus is identified and gently retracted superiorly. The tracheal rings are clearly visualized. Under controlled conditions, the endotracheal tube is withdrawn slightly, if present, while maintaining ventilation. A vertical tracheal incision is made between the second and third tracheal rings. The tracheal opening is dilated and an approximately sized cuff tracheostomy tube is inserted. The cuff is inflated and correct placement is confirmed by bilateral chest expansion, oxygen saturation, improvement, and capnography. The tube is secured with sutures and tapes. The procedure is completed without complications, and the patient remains hemodynamically stable. Mid-tracheostomy under local anesthesia is a safe and effective airway securing procedure in selected patients with head and neck malignancies. Thank you for watching. Please like, share, and subscribe.